This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So this is now my third PM&R Scholars Fair, and I remember being across the screen as a med student just when this all started. So this is super cool, and it's been really awesome to see PM&R Scholars grow, and I'm just really excited to be here. So my name is Kevin Nazare. I am a current PGY4 and chief resident at the UC Davis PM&R program. We're located in Sacramento, California. On the call here, I have Dakin Dawson, and I should have our other resident Varneet joining us really shortly. Dakin is a PGY2. He came on as a 1 through our categorical program. So he experienced Davis as a prelim, and then Varneet came on as an advanced resident. So she came on as a 2 from a different program. They're going to be on the chat answering questions as they come. So just feel free to fire off your questions just as we go. I find that it's a little bit more efficient where I don't have to just jam in a lot of answering questions at the very end. So please feel free to ask questions. We will try to address them at the end as well. All right, so we're gonna go ahead and get started. So this is our class. We're a small program, probably, this is all of us. It's probably smaller than most that you see. We are moving on to have everyone be, a class of 4. I'm the last remaining group of 3. And then we're gonna have, each class be at 4 residents at a time. So we bring on actually 2 categorical and 2 advanced positions. It's a little bit not as traditional, but overall, I think that it kind of adds some variety. So we do have some interns that we see that are a part of our family. And then we do, welcome in the new 2s the following year. So this is us. I think that we're a great diverse group, kind of a mix of DOs and MDs. Riley and Anita at the bottom there, they're just kind of coming on, getting their feet wet in intern year. We've got Austin Dakin, who's on the call, Mila and Zach, just a bunch of shining stars. And then Brad, Skylar, Corey, and Varney kind of round out our 3. And then myself, Aaron, and Connie, we are the remaining class of 3, and we are in our final stretch. So this is our crew. I'm not trying to, make this a confusing slide. I really just kind of wanted to highlight that our program adopts the space repetition model. So you get a little bit of everything every year, but we just kind of up the ante in terms of the responsibilities for every PGY year. So as a 2, you will do PM&R wards, and you'll do MSK clinic. You'll be doing injections, ultrasound guided, where you'll be in the sports clinic, spine clinic, rehab clinics. You're kind of focusing a little bit more on, the spasticity management, DME, kind of musculoskeletal, neuromuscular patients. And then we do get some exposure at the VA as well. As a 3, same types of clinics, but we kind of make the rotations a little bit different. The pain clinic, the VA is when you start to get early exposure to fluoro. And then we also kind of have you be our senior resident on wards when you're on inpatient. PGY4 is a little bit different. You start doing consults at that time. You're also doing an elective rotation. From personal experience, my program was actually able to have that elective come back to my PGY3 year. I'm going into pain. I'm going to find out in a month here where I'm going to end up. And they were able to give me some earlier pain exposure as a PGY3. I also do continuity clinic at the VA as well as a 4. Again, not trying to make you feel, confused as to this slide, but this is basically what we're handed. Again, just kind of emphasizing the point that it's a space repetition program. As far as didactics goes, we get the same cycle every year. So you see every lecture 3 times. I think that it's very helpful for me because you just kind of start to connect those neurotransmitters every time you see it. And then by the time you're a 4, it starts to really click, and I start to feel a little bit more prepared when the SAEs eventually come. So we do 2 days of didactics a week. On Tuesdays, we do have our 7:30 to 10:30 lectures, and this is protected time. So basically, if you're getting a page or if someone messages you, the attendings will take care of it. Thursdays, it's just 1 hour. Usually we kind of mix in journal club with grand rounds or maybe a case conference. And again, protected time. As I mentioned, it cycles every 12 months. Every resident does give a formal lecture every year, as well as a journal club presentation. And yeah, and we also do kind of do an EMG case here and there as well. I'm not going to spend too much time on this. This is our call schedule. A lot's changed in the past year and a half or so because we do have a new freestanding rehab hospital, but call is still home call. We do cover adults and peds patients. The big takeaway here is that as a PGY2, you have 11 weekends on call. As a 3, you have 10, and then as a 4, you have 8. It's split up between long and short call. Basically, long call, you're covering the adult rehab patients and then things after 5. As a short call resident, you cover peds and consults, kind of from 8 to 5. So it's more of a typical work day. Things are always changing. I mean, we're just kind of figuring out kind of how the scheduling works at the new rehab hospital, but right now, this is how things are. I really love our benefits. I feel like UC Davis takes great care of us. We are union based, so every year there's just like a new benefit, and I think that we really appreciate that. 28 total vacation days, 4 education days, 12 days of sick leave. We do have kind of resident half days mixed in so that we can take care of doctor's appointments or even just as needed, right? And then research half days to kind of focus on our project. We've got great insurance. I kind of had some knee issues recently, and I got to see some of the best sports doctor that are out there. And I really feel like that's an advantage for us. Stipends, we get fed well. We get an educational stipend from the program and from GME. So I feel like we get paid well. We get an onboarding housing stipend. And then as a 4th year, all of our conference costs are taken care of. I'm going to jump into kind of our specialties in our clinic. So we do have a number of faculty and a number of different subspecialties, brain injury medicine, spinal cord, pediatrics, and neuromuscular medicine. Sports medicine, I would say, if you could pick one strength of the program, I would say it's our sports divisions. And then we do have pain medicine attendings as well. We're also really lucky to have fellows in peds. They usually come on every 2 years, neuromuscular medicine, and then sports medicine every year. These are our faculty. Not going to spend too much time here. Just want to highlight a couple at the top. Dr. McDonald is the chair of the PM&R department, but we work with him a lot in the clinics. He is kind of one of the international leaders in Duchenne's muscular dystrophy research. So every time he talks, I listen. He's one of the smartest guys I've ever met. Dr. Davidson is our program director right now. He's a pediatric. He does pediatrics, kind of specializes in SCI as well, does Botox. He has taken over for Dr. Vandenacker, who was our prior program director. Now she kind of plays more of an APD role. So I'll get into some of the faculty a little bit later. Starting off with our inpatient rotation, we have patients that come from a large Northern California catchment, but primarily at UC Davis, which is a tertiary level 1 trauma center. We see a number of different patients, a wide array, SCI, TBI, polytrauma, ortho cases. We see a lot of neurologic conditions, and then these are our attendings that are currently on our inpatient service as well. We have a great time, a big resident room. I wish I could give you guys a tour, but it's really a great space that we have. Just want to highlight here that you might have heard that UC Davis has a brand new freestanding rehab hospital that opened up a little over a year ago. It's kind of partnered with LifePoint, which is a rehab joint venture. It's an incredible space with large rooms, big gym. Previously, we had a small dungeon down. We called it at the main UC Davis Center, but now we have everyone under one roof, living and breathing rehab. So we're really thrilled to have it. Kind of had some kinks to work out in the beginning, but things are running really smoothly now. Jumping into the outpatient clinics, I mentioned Dr. McDonald, who is our department chair. Him, Dr. Joyce, and Dr. Williams kind of run our adults and pediatric neuromuscular disease clinic. I mentioned fellowships. Actually, neuromuscular fellowship is the only PM&R based ACGME accredited neuromuscular medicine fellowship in the United States. So it's kind of a unique thing to our program. We do EMGs various places. I'll kind of get into that a little bit on the next slide. So the left is one of our prior residents who is no longer here, but we do a lot of didactics with EMGs. And honestly, if I would give you the second strength in our program, it is neuromuscular and exposure to EMGs. Day one of PGY 2-year, I was jumping in and I was, during neuroconduction studies, have never had a problem with my numbers. In fact, I hit all my numbers at the beginning of my PGY 3-year. You do it at UC Davis clinics, the VA, and at Shriners. And I'd say Dr. Joyce especially is really the one that kind of takes ownership of our learning when it comes to electrodiagnostics. Spinal cord injury, we just brought in a brand new Dr. Stone is one of our SCI fellowship trained attendings who he has really big plans for our SCI program at UC Davis. And I've just been working with him a lot lately on consults, and he's incredible. So we get to do a lot of care with the spinal cord injury population. Spasticity management is kind of run by Drs. Williams and Dr. Arsenault. We do a lot of baclofen pump refills, programming, troubleshooting, Botox injections, both ultrasound guided and palpation guided, and EMG guided, honestly. And then we kind of manage the oral antispasmodic agents. Dr. Shin is the one Swiss Army knife of the faculty. He primarily is the leader as far as amputee rehab goes, both at UC Davis and at the VA. And it's awesome because it's very multidisciplinary. We walk in the room with prosthetists, therapists, and patients feel very cared for at that clinic. I'm going to jump into C Street. C Street has both sports and spine clinics. Starting with sports, I would say it's just so awesome that we get a chance to work with such amazing attendings. On the top left, there is Dr. Herman and Mitch in the middle, who just graduated, and he is currently starting his sports fellowship at Stanford. Dr. Lear Whitney is not here, pictured here, but she also matched at Utah. We see a lot of patients, both athletes, whether they be on the Sacramento Republic team, the UC Davis football team, or just your weekend warrior. And then we have a lot of opportunity for sports coverage. Bottom left there is the California International Marathon that's been going on every year. And then bottom right was the marathon, and then bottom left is the Sacramento Republic. I cannot go on in this talk without mentioning Dr. Faustin. If you were logging on to watching the Olympics on NBC, you might have seen her with Suni Lee and Simone Biles. She is the she's the sports physician of the women's gymnastics team at USA. We're really proud of her. We're excited for everything that she's been able to accomplish in Team USA, and she's one of us. So I just had to throw a shout out and say that it's really cool that we get to have one of us represent Team USA. Spine Center with Dr. Shin and Dr. Vandenacker. We're really managing kind of a non-operative spine paradigms. We often refer people out for interventions, but kind of more focusing on the conservative therapies and spine care. And then in the C Street clinic, we do work side by side with the surgeons. So if there's a case that's surgical, we usually just turn around and have them come, talk about an MRI with them. Pediatric rehabilitation, right across the street from UC Davis is Shriners Children, which is an amazing children's hospital, and we see such a wide array of conditions: spinal cord injury, spina bifida, cerebral palsy, pediatric EMGs. Probably one of my favorite clinic in all of this whole program is the brachial plexus birth injury clinic. I don't know why, it's just so fun. We get to do it with Dr. Joyce Dagan. You're going to get to do that soon. We have the neuromuscular disease, and then we also kind of work side by side in the gait and motion analysis with the orthopedist. So it's really cool. We also do a little bit of pediatric sports medicine with Dr. Ingerson. I got to do some really cool like prolotherapy, PRP injections with her. And then we do work at the VA in every one of our years. We kind of focus on more of like a spine and MSK conditions. This is where we get our pain exposure. Dr. Hovez has like this famous podcast. I don't know if you guys know about it, the Spine and Nerve Diagnostic Podcast. He's been kind of one of my mentors and wrote me a letter of rec, but he's kind of the one who showed me, just basic fluoro. And by the time that I did an elective rotation, they said, wow, like, you have, really good hands, and I owe it a lot to him. But at the VA, we also do some prosthetic management, palliative care, limb deficiency, and then recently we incorporated addiction medicine to our curriculum. And we do get a little bit of exposure at Kaiser, where we learn about occupational medicine. Dr. Palvolgi is one of our alumna, and she exposes us to kind of some of the more managed care and work-related injuries and kind of how that all fits into PM&R. Didactics, like I said, every Tuesday for 3 hours and then every Thursday for 1 hour. We get to work a lot with each other. We have some amazing people that come in and lecture us. We are scanning each other. We are injecting each other. We are, well, we're poking each other with EMGs, not injecting. But we, get to kind of practice on each other. And I just feel like it's a great space for us. And honestly, I think that it's a program that is really emphasizing kind of the academics of PM&R. So we're really happy that we get a lot of space for didactics and academics. Adaptive sports with athleisure is something that, was really strong, and then kind of COVID hit, and then we kind of been trying to bring it back, but that is an aspect of our program that's really exciting. And then resident research. Dr. Herman in the bottom right is sort of our research mentor at this point. I think that our program has gotten really, really a lot more robust since he's come on. So Mitch has been talking, did a project where he, looked at concussions in surfing, and he did a great job over there. So we do eventually get to go to conference at AAPM&R and present our findings, and eventually we get to a manuscript at the end of all of it. Wellness, we do a lot of wellness events. That's Top Golf, that we went to Tahoe one year, and then, we'll just chill on the river. And then pictures, yay. So we have a lot of fun with each other. I know it's said so many times, but I truly believe that we are a family. That's probably the best aspect of our program. The group chat is on fire right now. Just like, hey, we got this going on. Dakin and I are in a little golf group chat where we're just like going, I mean, every week or so, maybe even more than that. But just like even the attendings, like they invite us to our houses, and we have Halloween parties, holiday parties, etc. Just some more pictures here. The right picture is recently, we went out there, and then up at the top middle was 3 of our graduates. That's at Tahoe for one of our retreats. And then I know that we have a big climbing wall group as well. So have to talk about Sacramento a little bit. For those who don't know, Sacramento is in Northern California, kind of in the Central Coast. It's kind of smack dab in the middle of Tahoe and San Francisco, the Central Valley near Yosemite, and then in wine country in Nevada. Previously, it was known as the City of Trees, but now it's called the Farm to Fork capital of the world. So it's kind of more agricultural, but the food is amazing. It's like so fresh. I think that Sacramento, for some reason, has had a bad rap amongst California cities. I don't know what's up with that, because ever since I've been here, it's been so much fun. It's very lively. It's very up and coming, especially certain pockets. And it's the capital of California. And then we have to talk about sports because, who doesn't love sports? I'm a Warriors fan, but it was really hard not to be a Kings fan recently. Things have been going crazy with them, like the beam. The beam you can see from space. It's crazy. And then we have, a number of sports teams, UC Davis and Sacramento State. There's Sacramento Republic, the soccer team, River Cats, the minor league team. And then coming soon, the A's are going to be living in Sacramento for about 3 years. So by the time you guys come on, that's going to be what's here. So that's my presentation. Thanks so much for being here to hear about our program. We are active on X and on Instagram at UC Davis PM&R. Up at the top right is our website. And I could have put all our emails here, but just go ahead and look up our website under resident bios, and each of us have our email there. So please feel free to reach out. You're never a bother. I can just kind of say personally, I chose UC Davis because of the alumni network, the faculty to resident ratio. And I also went to UC Davis for my undergrad and kind of felt like this was always a home for me. Davis as a whole is a very nice, kind group, just as a hospital system in general. So you not only get the academic quality, but also just the kindness of people around me. So I will stop there. I appreciate Dakin kind of fielding questions in the chat right there. But given that we have a couple more minutes, I will open it up for questions. And if not, if you guys don't have any more questions, maybe Dakin, do you want to say something or two about sort of why you like our program, or and anything?
Yeah, I'm happy to share. I really like UC Davis. I mean, it's a very small, close-knit program, but that leads to a lot of kind of great opportunities. Whether you're interested in neuromuscular disease, pediatrics, I think that those are some more niche specialties within PM&R that you get a lot of exposure to here at Davis that other programs you may not get as much exposure to. I know a lot of people are interested in pain and sports, and that's certainly something here that we're able to facilitate. I myself am also interested in pain medicine, and I'm also interested in research and academics, and it's been pretty easy, early on in PGY2, you're getting involved with the pain department here, sending out some abstracts for upcoming pain conferences. So if you're interested in research, there are stuff available as well. So certainly a lot of opportunities and growth to be had here.
I'm seeing a question. Are there any structured and or unstructured mentorship at UC Davis? Yes, great question. We actually just had an email recently where every single resident does get paired with kind of more of an official mentor. Usually they try to pair them based on interest in their field. And we kind of check in with each other once a quarter and kind of on both a formal and or an informal way. So, and then, I mean, you can have anyone be your mentor if you just, if you just ask. So there's like research mentors, formal mentors, and then I like to call them social mentors for if you want to get a beer after work.